Great. Well, thank you, everybody, and welcome. Good morning to some of you, good afternoon to the others, and good evening to the remaining lot, wherever you are in the world. We are so delighted to have you join us today on what I believe is World Bipolar Day. Welcome to the launch event of Healthy Brains Global Report, Paying for Outcomes on Mental Health Programs. I'm hoping that many of you have already seen the report. It's been circulating for a while, but this is the official launch. So really pleased to have you join us. I'm particularly pleased to see so many of our of the service providers who have been featured in the report are here on the call with us today. And I want to go on record our gratitude and our thanks to those service providers for engaging with us over a span of time, 6 to 9 months. Without your involvement, your engagement, your interest, this report would not have happened and would not have been possible. So thank you. I'm also really pleased to see some members of our Lived Experience Council on the call with us, affectionately known as the LEC for us. The Lived Experience Council are an integral part of our organisation and what we do. And what they do ensure is that the user voice, the voices of those who live with mental ill health is heard, but also informs everything that we do at HBGI. I don't want to call on anybody, but if you guys want to flash your cameras on for 2 seconds and wave, feel free to. I said I wasn't going to call on anyone, but Joanna, I can see you're on the call. Kimberly, previous member of the LEC, lovely to have you on board. Thank you all. So for those of you that do not know me, I am Shamsia Ali. I'm a special advisor at the HBGI team, and I had the pleasure of working with the service providers in producing the report. I also have the pleasure of hosting this session today and taking you through it. So welcome again. You will all be pleased to know that you just won't be hearing from me. So let me take this opportunity to introduce you to some of the other speakers. And also some members of our team, even if they're not speaking. So let me go first with my boss, Richard. Richard Johnson is the CEO of HBGI, and previous to joining a Healthy Brains Global Initiative, Richard's background also included being a senior advisor with the Global Fund for fighting AIDS, TB and malaria. He was also a senior consultant at the World Bank, where Richard spent 4 years in Afghanistan, advising the Ministry of Health there in terms of contracting out health services, particularly linking payments to key health interventions. Richard, in over sort of 2 decades plus some. Jamie, welcome. Really good to have you on board. Sorry to call your name out. You've gone on mute. Perfect. Where was I? Richard has his career heavily in the land of outcomes-based contracting, results-based financing, whatever the name terminology that you might be used to, which includes chairing 10 impact bonds. Richard continues to be the chair on some of those, including a development impact bond in Palestine, which is working with youth unemployment, and a similar one in South Africa. So good to have Richard, and you'll hear from Richard in a little while. We're really pleased to have a couple of the providers that feature in our report also join us today, and you will be hearing from them a little bit later. Really fascinating presentation. We had a session earlier in the day for those in that time zone of the world, and honestly, really great presentation from both. So let me introduce you to Benoit Renard from Triggerise. Benoit is the CEO and co-founder of Triggerise, and co-founded Triggerise back in 2014. Benoit will give another introduction to himself when he does his presentation, but I know his previous background has involved working in marketing across a number of sectors, including for and not-for-profit, and has worked in a range of countries, including France, as will become apparent, but also Swaziland, Mozambique, and South Africa. Thanks for joining us, Benoit. We're also really pleased to have Timothy Coniver. Tim, I can't believe I just called you by your full name, and that's because that's how it comes up. Sorry if I sounded like your mother there. From Waves for Change. Tim is the CEO there and also co-founded the organisation in 2011 in Cape Town, South Africa. Again, Tim will probably do a bit of an introduction to himself ahead of his presentation. Well, a number of accolades, including being an Ashoka Fellow since 2015. So Tim, really good to have you on board. I wanted to take this opportunity to also introduce a couple of other colleagues, team members. So Roxanne has joined us on a fellowship from McKinsey, and this is week 2. So deep in, and really good to have you join us today, Roxanne. I also wanted to introduce you to Jonathan Sherin, who might have just turned his camera off. There you go. Good to have you back on, Jonathan, and thank you for joining us. Jonathan is a senior advisor at HBGI and comes with years and years of experience in the mental health service, particularly from the other side of the world, the other side of the pond from where I am in the US. So really good to have you join us, John, and welcome. So I think that is introductions done. Please do feel free to introduce yourself in the chat as well. So we are together for about 2 hours. We may finish a little bit early and give you some time back, which is never a bad thing on a Thursday. As I said, we are recording, so please do go on mute, but you will have an opportunity to ask us questions and raise comments and thoughts, and of course unmute yourself then. But please do also post comments and questions on the chat, which Roxanne and Richard will be monitoring and supporting me with, so thank you. The recording and the slide deck that we use today will be made available after the launch, so don't worry about furiously scribbling. And if that's okay, brilliant, we will make a start. So just give me a second whilst I get the presentation up and share on our screen. Right. Richard, can I come back to you for a yes, you can see that, and it's all clear?
It's all clear.
Perfect.
Thank you.
Brilliant. Thank you. Hopefully you've all seen this slide, which was sent out with the invitation and the Zoom invite earlier on. It's just the structure of the next couple of hours, high level structure. So I won't go through it in any more detail. Let's start with putting us in sort of in context, the lay of the land, so to speak. The reason why we're all here and the reason why we're all in the mental health space. This is the global picture, what you can see on the slide deck here. These figures will be familiar, these stats and figures will be familiar to all of you, and most of you will probably be much more intimately aware of these data than I am. But what they do show is the huge need globally in terms of mental health. It affects us all in some way or another. And more than 1 billion of us are affected by poor mental health globally. It is a shadow pandemic, and it is a shadow pandemic that has been made worse as a result of the more recognized pandemic, the more recent one, COVID-19. And that COVID-19 absolutely has accelerated the decline in mental health. Most of you will be aware that there's been a 25% increase in anxiety and depression globally, and that's even more acute within our young people. The cost of poor mental health and failing to respond to it is significant too. You know, there's the stat there, $1 trillion in cost to the global economy. And actually that also increases amount of spending that is required elsewhere in public services. So the criminal justice sector, for example, where mental health is often treated as a criminal offence. And the education sector is another good example. Despite the spread and the need and the cost of mental health, poor mental health, generally governments across the globe are still not spending enough on this. Less than 2% of government health budgets is being spent on addressing mental health, their causes and consequences. So this slide gives us a snapshot of the global context. I wanted to also take a moment to look at a regional variation. We know that that global picture, is replicated, but there is also nuances and differences from geography to geography, location to location. And so just pick the African continent as a region to focus on for this session. What this slide shows is that actually the need is significant on the continent. 1 in 7 young people are estimated to have a mental health condition. Despite the high need on the continent, access to mental health support and services is incredibly poor. I mean, the stats here speak for themselves. More than 4 out of 5 people who are experiencing poor mental health actually can't access the treatment that they need. And those that can, where access is available, the cost is often prohibitive. Again, one of the stats here's figures speak for themselves. Africans have the highest out-of-pocket expenditure for receiving psychiatric services, which is worrying. And again, on the continent, we know the picture, the nuance will vary from country to country. And we saw a lot of that in the expression of interest that was submitted to HBGI, where the service providers operating on the continent in those different countries really did evidence the challenge and the need that they are addressing. So this slide marries with the previous slides, which really gave the numbers, the stats, the figures. But we know behind all of this, the figures, the numbers, we know that there is the real human story, the human toll, the human impact. It is now widely acknowledged that poor mental health has an adverse impact on real world outcomes for those that are suffering. And this slide just gives a handful of examples of the adverse impact of poor mental health. We know that if you're experiencing from poor mental health, it is likely to impair your occupational achievement, indeed your ability to stay in work or secure work. We know that poor mental health amongst young people, amongst students, can have an adverse effect on their educational and can contribute to educational underperformance, and indeed the ability to stay in school attendance, as well as school completion. Mental health has a huge impact on physical health. And many of you, if not all of you, will be familiar with the phrase that we've got here, no health without mental health. Unfortunately, the trajectory doesn't look great either. If we continue the path that we are, unless coordinated action is taken, by 2030, mental health condition will be one of the top 3 causes of both morbidity and mortality globally. That is alarming, but we also thankfully know that the opposite is true, that good mental health can reverse some of these adverse impacts. And the engagement that we've had with the global service provider market over the last 6 months fills us with encouragement and hope, and shows and demonstrates really well actually the difference that you all are making on the ground in the services that you're providing and the impact you're having. So this isn't all doom and gloom. But we think, of course, that the impact that you're having could be significantly increased if we were to look at how we contract those services so that they focus on the outcomes and the results and the impact we want. So though there is lots to do, a lot of good work is happening, and we absolutely can help to make a difference. I'm now going to hand over to Richard, who will give you provide us with an overview on HBGI, who we are, and an introduction to outcomes. So Richard, over to you.
Thank you, Shamsia, and thank you everybody for taking the time to come and listen to us today. I hope you find the session interesting. As Shamsia says, we've got a couple of service providers following on from me, who I think really are describing some very compelling and very interesting programs. Our objective at HBGI is to significantly increase the scale of services and the level of understanding around poor mental health and its causes and its consequences, particularly reaching the people who are currently ignored and excluded. Such services and understanding that currently exist are generally focused on white, wealthy communities. Beyond that, there is a low level of understanding, and in many places, simply no interventions, no services at all. So HBGI is looking to target low-income countries as well as excluded communities in the wealthy nations, such as in the States, there are nearly 600,000 homeless people there. And when you get into these communities, it becomes clear that mental health challenges are just part and parcel of everyday life. They're often difficult to separate out from the experience of those everyday lives. They go hand in hand with poverty and poor physical health and lack of stable employment or a combination of schooling, as Shamsia has already referenced. Next slide, please, Shamsia. We're going to go about doing this in three ways. First of all, we're looking to pool the funds of donors. These donors will be philanthropists, foundations, global institutions, wealthy nations, and we're looking to create outcomes funds. We will use these funds to contract and to pay for and to performance manage new programs targeting poor mental health causes and consequences on the basis of the functional, real-life outcomes that they deliver. We know that many of these institutions have an interest in results, but are simply not set up to contract for programs in this way, to provide this focus on performance in this way. We're going to shape these funds at times with a geographical focus, so a fund for Africa that we've been working on for 6 months now. We're also going to look to create thematic funds where we will focus on particular themes related to the mental health challenge or indeed the solution to that mental health challenge. So our first fund is an outcomes fund for sport and mental health. We're then also going to look at new brains in terms of newborns and maternal health. We'll look perhaps at technology, also veterans in terms of the veterans in the USA, but the veterans we're producing in the Ukraine, and the veterans in low-income, conflict-affected areas where there may be child soldiers, and other themes as they emerge. Second, there may be donors who have a particular interest in a particular area, particular population, particular need, and we can help those donors to connect their money more effectively with those solutions, again, through using performance-based or outcome-based contracts. And thirdly, we're looking to partner with, to provide technical assistance to governments, national governments, local governments, to help them think about how they can use clever contracting as a tool to really deliver the sort of impact that they want their money to be giving them. The next slide, please, Shamsia. I first came across the results chain when I started doing some consultancy work for the World Bank. Of course, the idea of the results chain is used by many others as well. I think it's probably essentially what people sometimes call the theory of change. But the notion that you can describe a program, a service in terms of the inputs, the activities, the outputs, the outcomes, and its impact. Employment services are a very neat way to explain this model because you can break down the elements of that program very neatly, such that the inputs are the staff that you employ, the premises, the offices that you open. The activities would be engaging with the job seeker, coming up with a CV with them, working on a CV with them, putting them onto a training program. The outputs would be the completion of that CV, the completion of the training program, possibly securing a qualification of some sort. But then the outcome, the key outcome that you're aiming to achieve throughout this program is the individual securing employment and then sustaining that employment for whatever time span is agreed. The impact that we're after is surely a reduction in the rate of unemployment or an increase in the rate of employment. But when we buy services as donors, no, you go back again, Shamsia, you've gone too quickly. When we buy services as donors or as governments, we usually either provide a block grant to cover the organization's budget for the whole of what they're doing, or we pay for the inputs or the activities, possibly sometimes the outputs. So the block grant approach, for example, is what the Global Fund essentially do. They reimburse budgets, they reimburse expenditure. And the payment of inputs, activities, outputs, that's how the World Bank would go about procuring a training program. And neither of them work. Neither of them are efficient or effective. Those training programs do not necessarily, and indeed in many cases, they simply don't lead on to employment, even though that was the intended objective. We need to attach the payment to the performance. We need to drive performance through everything that that program does. We need to tie it as closely as possible to the outcome and not the impact. The impact often is too far away. Now, in some instances, and we might talk about this in terms of managing working capital or cash flow within a program, or indeed in determining exactly what that outcome is that we're going to measure, particularly in relation maybe to mental health, we need to start moving some of our payments further down the results chain and think about outputs and what we might attach the payment to there. But the key point is to understand these performance drivers within the program and find how the clearest way possible to attach our money to each of those drivers with a focus as far as possible on that green box. Now you can move on, Shamsia, thank you. In terms of outcomes, we're interested, as I said already, as Shamsia said already, in the real life outcomes that actually shift an individual's life chances. These will be context dependent. They will change from place to place. They will change from program to program. And I hope that you will hear from Benoit at Triggerise and Tim at Waves for Change, how they're focusing on this, how they're looking to really deliver that life-changing outcome for the individuals that they reach. It is a big challenge for many providers and for many funders. Many who think they have got the perfect answer in the activities and the inputs that they've designed, and they lose sight of actually where that individual should be headed. We simply think that we know what a program should contain. We design these solutions in detail in Washington or London or Geneva, and then we impose them on people a million miles away. Next slide, please, Shamsia. Performance contracting, outcomes contracting, when it's done well, and you can get this wrong like you can get any contracting wrong. When you do this contracting right, it has got the power to drive services to focus on the individual, to be truly bottom up with the user voice shaping the service, because that's how you achieve the outcome. Paying for these outcomes maximizes the number of them, the number of outcomes that we achieve. And if they're well defined and there's good governance in place, it can also drive an increase in the quality of the service. After all, if you're going to achieve a lot of outcomes, you can't do it through a poor quality service. You can't do it through a service that doesn't listen to the individual, doesn't listen to their needs, and provides something that responds to that. These sorts of contracts are real value for money. Value for money does not mean cheap. The cheapest program is not the best value for money. Value for money means that the money that you spend actually delivers what it is that you're looking to buy. They deliver what I want to pay for. So many demands on donors right now, that's not going to go away. And at the same time, there is so much waste in the systems. There is so much waste in how that money is spent. We think through a performance-based and outcome-based model, we can show you exactly where your money goes. We can tie it to outcomes, not vague grant expenditure. Managing this, if you're delivering one of these programs, you have to track everybody you engage with through that results chain, all the way through to your outcome. That makes it data rich. These programs are uniquely data rich. I've come across so many grant funded programs around the world that simply don't know how many people they've got on their program. They don't know what their caseload is. They certainly don't know what happens to the people once they're on that caseload. To deliver a contract like this, you have to be tracking in that way. Let's not think we know best, but let's enable communities to create what works for them. And this is the tool to do that. Let's stop measuring success in terms of absorption or disbursement, i.e. whether we've spent our budget. And let's measure it in terms of the real outcomes, the life-changing outcomes that are important for the individual. And let's use the basic drivers, the basic incentives of contracting to achieve this. I was incredibly excited by this whole exercise that is being described for you here. We put out this call for expressions of interest. Shamsia will describe for you the motivations that we had in doing so. And we really didn't know what would come back. what we've had now is 6 months of pretty intense engagement between Shamsia and the respondents to that call for expressions of interest. And what we started to see was a market of service providers with a remarkable level of commitment, a huge appetite for what we're talking about here, a great diversity in those providers, and a passion for what they're doing. Shamsia, please tell us more.
Thanks, Rick.
Oh, we have the questions first. I always forget we have the questions first.
Forgivable. We will take a moment now just for any questions or comments that you do have. I'd like to open it to the floor, so to speak. So please do raise your hands and come.
Can I just preface it, Shamsi, with the fact, and I know you're going to talk about this later, but we're aiming to have a series of seminars, workshops over the coming months, one every 6 weeks or so, which will look at elements of this. And the next one, the first one in 6 weeks, we're going to deep dive a bit more into outcomes contracting, what it is, how it compares with other contracting models, some of the more detail around it. But we've got a hand up. Yes. Sorry, I can't see your first name. N. Pandi.
And I would say, Nirala, when you speak, please just do briefly introduce your name and the organisation you're from.
Hi. Hi. So I am Nirmala Pandey. I am working as child protection specialist with UNICEF India Country Office. And I'm also the focal point for our multi-sectoral mental health and psychosocial support program, which is one of the key, deliverables for UNICEF India Country Office now, and as also a priority. I'm working together now with Sachin Trust Circle, and we are implementing some programs, but that is only a part of our interventions. Because our programs are like much large scale. It was very interesting the way Richard explained that, how we are trying to actually track what our interventions are going to be, the results-based management. I mean, we use that word and we try our best. My question is, that when we are doing a large-scale program, how do you really measure those impacts, as you call it? Because mental health, at least for India, I know that the data is very much limited. We don't have a larger tracking systems where we are actually measuring what are the mental health outcomes are. I mean, for India, I know for sure that the last survey which was done was in 2015, and after that, we never had any mental health survey, So, and I know that is the condition for all our neighboring countries, at least in Southeast Asia. I don't know about other parts of the world. So in that context, how do you really suggest that we actually link it to the outcomes and try and measure them?
Right.
Nebla, thank you very much. Thank you for joining us from India, and thank you very much for a great question. In the presentations that are going to come from Tim and Benoit, I think you will see some very powerful responses to that question in terms of the data they're capturing and what they're doing with it and how they're using it to drive their programs. In hearing your question, I feel I want to very carefully distinguish here between performance data that tells us what is happening on a program as it's being delivered, and the sort of data that is commonly captured in an impact evaluation. You reference a household survey, and I know that's a common tool in an impact evaluation. I firmly believe we need to do impact evaluations and learn from them, but I have a problem with them as well, in that they often happen greatly divorced from the program and its actual delivery, often 2 or 3 years afterwards, and they cannot then impact on whether that program is really delivering or not. We only know, in fact, whether that program is delivering or not if, alongside our delivery, within our delivery, we implement a system which is able to actively record, track, report, and enable the reviewing of what is going on within that service. data is a vital part of performance delivery and performance management. And as I say, wait and listen and see what Tim and Benoit are doing in relation to this. They are exemplars of best practice, possibly for some of us to aspire to, but seeing how closely that data relates to their achievement, I think is very a powerful illustration. Steph, can I come to you?
Thank you. It was so great. Oh, yes, so I'm Steph. I'm the head of global impact at Batir. Thank you so much for taking some questions. It was really great to hear a bit about, Richard, you discussing quality and impact really centered on beneficiaries and what, say, for example, our organization, we reach young people, we work directly with young people. So taking that time to ensure that what we're actually developing is going to have that impact we're looking for based on, working directly with young people is really important. And then, it was really, I think, a really important point this morning as well to hear a bit about the lack of global funding that exists, that we all know exists as well. So I think with thinking about funding kind of coming in once the impact is achieved, but knowing that in order to achieve that impact, a lot of groundwork has to happen first to make sure you're actually going to create the outcomes you're looking for. I guess I'm just trying to understand as well, do you feel that and you also mentioned that you recognize that there might need to be times where funders are able to move up the resourcing towards outputs. Is there a world in which it can be a bit of both, where there's still opportunity for organizations to have access to funds to do the groundwork, which is required to then create the outcomes as well?
Yeah, sure. Thank you, Steph. And you joined this morning as well. You're a glutton for punishment. So there's and I can't assume people were also here this morning and have the conversation, but we talked about how it can be necessary to attach money to every stage of the results chain for a number of different reasons. One is to ensure that you've got cash in your system, that you're providing working capital to an organization to actually deliver. And one is that it might be more appropriate in some settings to move those payments further to the left on that results chain. One sort of powerful lesson for me in relation to this was when I did do the work in Afghanistan. So there we worked with the World Bank and the Ministry of Public Health to shift effectively all of their basic and essential health services, which are all delivered by contracted NGOs, or were until the Taliban came back. We worked to shift all of those contracts to a performance-based payment model, where basically we identified 11 key health interventions and attached a price to each one of them. And the more of each one of those that they delivered, the more the NGO could invoice. And they would be things like immunizations. Now, is an immunization an outcome or an output? I don't really know, but we know that there is, an incredibly strong evidence base demonstrating that the immunization is actually going to deliver the reduction in the disease. And we're happy to take that as proxy of our outcome and our impact. So you've got to design it. You've got to design that payment model as appropriate to the circumstances, and actually probably come back to the question, which we try to ask at the beginning of any contract design, which is, what does success look like here? Can we cleanly, simply define success? If we can, then how do we design a payment model that is going to drive as much of that success as we can? I think part of your question, though, is also about the development of new programs and the piloting of new stuff. It may be in some instances necessary to move towards an outcome-based contract, starting off with, let's say, a year of data gathering in which you establish that evidence base that enables then you to implement an outcome-based payment model. And that model is being used in a number of the impact bonds around the world to create that baseline of data to inform the payments. I have to say, we cannot be everything for everybody. We've got to go out and raise the funds for these outcomes funds. We've then, in the first instance, got to try and contract some programs that demonstrate to the donors, to the global community, the power of this model. And we can't be everything to everybody. And I think we're going to have to look to the likes of Grand Challengers Canada to invest in the development of new models that they then bring on to the point where we can pick them up and try and scale them using this model. I hope that answers the question, Steph. There aren't necessarily final, absolute easy answers to all of these. Sachin.
Am I audible to everyone?
You are, we can hear you loud and clear.
Okay, thank you. Thank you, Richard. Thank you, Shamsia. This is Sachin Chaudhary, everyone, founder of Trust Circle and Bring Change Foundation. I'm also a caregiver of a brother who was bullied in school and was diagnosed with mental health issue. My key question here is, this is great, where we are setting up these outcome funds and we are in conversations with donors. But Richard, let's say there is an opportunity where we see at scale we can implement some solution, and there is support from the ground, and there is intent, and there is interest, whether it could be Ministry of Education, Ministry of Health, or it could be at state levels, or it could be at country levels. And if there is a lot of momentum, inertia from these decision makers, and they are ready to implement a solution, at that point in time, and maybe outcome funds may not have set up for serving that region, or maybe not that, for example, we're focused on homeless, or it may be, the opportunity might be for students in schools through Ministry of Education, or through the Ministry of Health. So how do we match? Can we as service providers bring those opportunities to you and say that here is the interest, here are the stakeholders, they are ready to join forces. Can we do something about it? I know these are parallel tracks, and at some point they will have to meet. But is it a sequential process where we see that the fund is set up, only then the opportunity can be brought up? Or as service providers, as we are hustling, as we are moving things forward with a passion and purpose, can we bring these opportunities to HPGI and say, this is on the table, can we look at it?
I did click on it, it didn't come off. Thank you, Sachin. Look, actually, this whole call for expressions of interest was part of that process, was saying, come and tell us what you're doing. We want to take what you're doing out and tell people about it. We want to publicize the strengths and the opportunities that are out there. We're creating these outcome funds because we think in creating these, we're addressing a weakness in the system, in that we need to be paying for outcomes, but there's a lack of outcome funders. So we're going to become an outcome funder. We're creating them because we actually think this argument is something that may be attractive to certain types of donors who otherwise wouldn't be giving to this sector and to programs like this. Right. So we're creating a pitch to them through using outcomes funds. And we're doing it in order to maximize the impact of these programs, because we actually think this form of contracting is a powerful tool. And we've got to focus our work, because through focusing it, we're more likely to succeed. If you had an instance where there were a whole bunch of there's a provider, there's a program, there's a whole bunch of stakeholders who are behind it, then of course we need to talk and engage with those stakeholders and see how we can support and facilitate what you're doing. Horribly in this world, it generally then comes back to who's going to pay for it.
And which is a good problem to have.
Yeah. But thank you, Sachin. I will take one more question from Pavel, and then Shamsi, you're going to move us on.
Hi, everybody. Richard, it's a pleasure to meet you. My question is a little bit different than kind of speaking about the topical area at the moment. And I want to start by maybe heaping some praise towards you all. But maybe specifically Shamsia, we are often in conversation and partnership with funders, foundations, as I think many of the folks on this call. This exchange, this collaboration partnership with HPGI, primarily Shamsia, has been the best I have ever experienced, truly, in terms of transparency, presence, thoughtfulness, willingness to work together, just a myriad of kind of successful things that really aided in making this such a wonderful experience on my end. And from your experience, Richard, you've been in many circles. Why do you think other decision makers or funders or foundations don't exhibit a similar sense and spirit of collaboration? Because I often hear that there is no power imbalance, but there is. And I never felt that once with you guys. And I think that's a testament to what you guys are building and the culture behind it. But again, why do you think others are not as willing to foster such a sense of trust and collaboration?
Thank you, Pavel. That's very kind. I can see Shamsia blushing from here. I'm glad you've experienced the process in that way. I really am glad. That's how we set out to deliver it, and that's the sort of collaboration that we look to continue through purely selfish, hard-nosed reasons, to be honest, because we think if we're going to deliver the best possible response to that individual in that community, we have to do it through collaboration, through stewardship of the service provider, through enabling rather than anything else. Why don't others do it? I'm not going to get into that, Pavel, today, to be honest. But perhaps we'll explore it in the forthcoming workshops. There was one further question in the chat room from Andrew about how we were getting on with our outcomes funders. Andrew, we had great engagement on the ground in Africa. The ultimate outcome funder, the ultimate funder for African programs would probably, to be honest, be USAID, maybe FCDO when they get themselves sorted, and others like that. And these organizations are very clear in the way that they currently fund and deliver and procure and contract. And I think that conversation is a medium to long-term one and a bit of a slow burn. That's why we've started to create these thematic outcome funds to try and create a picture hook that we think we can draw a different sort of donor into. And we have just now, with the Outcomes Fund for Sport and Mental Health, just now started to engage with the owners of sports clubs. So we're looking at the owners of the baseball and the football clubs, American football clubs in America. We're going to try and engage with maybe some of the overseas people who own the football clubs in the UK and the cricket club owners in India. We're looking for high net worth individuals who recognize that sport is a power for social good, and that clever contracting is actually something that they might get because of where they come from. And we're at the beginning of that process. We launched that 2 or 3 weeks ago in terms of presenting it to them. We are speaking to UEFA too, Andrea, and I was with Lee yesterday.
Liam.
Liam. I was with
Sounds
Liam
like you're
yesterday.
connected with the UNESCO crowd as well. Great.
We were at a UNESCO roundtable yesterday, and I will be picking up the conversation with him. Thank you, Andrea. Shamsia, can you move us on?
Brilliant. Great. Thanks, everyone, for your comments and questions. We will move on. And I'm sorry that I've been scrolling through the slides unintentionally. So just to give you a bit of a background in terms of how we got to creating and producing the report that we did. So I'll move on to this next slide. Last summer, back in July 2022, we launched a call for expressions of interest, a call that had no funding attached to it and a contract to be issued. But what we wanted to do, and Richard has been alluding to this throughout, what we wanted to do was collate examples of mental health programs that were already being delivered, which could be amenable to being paid on outcomes. So they don't need to have already been paid on outcomes, but they could be paid on outcomes. And we also wanted to use that opportunity to engage with a lot of you on this call, to engage with the global service provider market, and the feelings very mutual, Pavel, so thank you. And the reason we did this was actually when we were talking, and Richard in particular was talking to potential funders and donors, they were posing us the questions that you can see on this slide. They really wanted to know, actually, is there a market for this? Do the service providers have the interest and capacity to be paid on outcomes, and kind of what kind of programs would you be funding? So we went ahead and did this launch for call for expressions of interest. When we did do this at the start, we had absolutely, I think Richard said this earlier, or he might have said it in the session we had before. We really were unsure in terms of what sort of response we would receive. So we were pleasantly surprised and overwhelmed that we had responses from 45 different organisations. Stephanie, Batir and Sachin and Trust Circle and Pavel and Fine Mind are examples of those, proposing 51 different programs. Some of the proposed programs were familiar with outcomes-based contracting and actually do deliver or have delivered in the past. Most of the programs and most of the organisations, therefore, were not familiar with outcomes-based contracting. And that is actually what we expected when we launched this call. Given that outcomes-based contracting is still new, and particularly new in this space around mental ill health, we were not surprised by that. Our initial aim when we launched the call was to find a handful of examples, you know, half a dozen to a dozen of examples that we could use in our conversations with with potential funders and donors, and say, look, these are the type of programs that could be paid in outcomes. These are the type of outcomes that we could achieve. These are the type of organisations that we could work with. But as we started reading through your expressions of interest and started engaging with the market, what was very clear actually is that the interest is absolutely there. The service provider market absolutely have an appetite to being paid on outcomes-based contracting and have a real interest. And actually these programs can be paid on outcomes. That was one of the greatest learning we had through this process. And our call had limited distribution channels and limited time frame. So we probably only just scratched the surface in terms of interest and capacity. Through our engagement, what became very apparent was that you were all very willing to engage with us, and you gave a lot of time and energy and resources. And it absolutely did no longer feel right that we would only be picking a handful of those examples to showcase in our conversations with potential funders and donors. So we took the decision to highlight all of you, to feature every one of these programs in our report. And that is how we got to the report that we have published. And as I said right at the beginning, that would not have happened had we not had the level of collaboration and engagement at your end as well. So thank you. For those of you that have seen the report, I hope you have found it interesting and fascinating. For those that have yet to see it, please do peruse those featured programs. We give an overview of the proposed interventions as well as the possible outcomes, particularly focusing on functional outcomes. We do actually then highlight 11 of those programs in more detail, given a sense of the potential costs and some evidence to demonstrate the effectiveness of the proposal. So again, do have a look through that. I think what the programs that are featured, what they do demonstrate is the breadth and the richness and the real potential of the provider market to deliver significant impact in this area if contracting was focused on outcomes. Let me move us on. I have already spoken about this, so we'll move on. This slide gives just a snapshot of the proposed geography of those interventions that have been featured in our report. When we went out for the call, Richard talked about regional focused outcomes fund. And when we did go out for the call last summer, we were focusing on 4 geographical regions. So the African continent, South Asia, California, I'll come back to California, and Eastern Europe, particularly focusing on Ukraine, given the Russian invasion and the impact on mental health, particularly amongst young people. California might seem like a bit of an outlier. Jonathan Sharon will tell us absolutely not, but there is a huge need in California in terms of mental health. But there's also real opportunity for us to do some really exciting things and and make real impact, given the potential funding that's available. And we're also an American-based organisation with roots in California. So hence this geographical spread. But we remain open and opportunistic, and we did receive EOIs from other geographies. we could not mention every one of the providers in this session, so I wanted to share this slide to give you a sense of who those providers are that are featured in our report and the geographies that they're proposing. Do please have a look at the report. In the report, we do provide a really good summary, not of just the individual programs, but an overall summary of the different types of interventions that have been proposed, from interventions that look at livelihood, whether it's employment support or increasing income, to school-based intervention, to tech-focused interventions, to interventions that look at comorbidity. And actually, Triggerise's presentation will talk about that in terms of mental health integrating with HIV support. We give a good overall summary of the type of beneficiary groups that have been targeted, from young people to mothers and expectant mothers, to rural isolated communities, and the range of organisations, predominantly NGOs, but not just not-for-profits and NGOs. We've had the public sector also submit interest. And we also give a summary of the types of outcomes, particularly focusing on the types of functional outcomes that could be achieved. So this nicely moves us on to the next section. I'm really delighted again to have Tim and Benoit join us. They will give us an overview of their organisation, the proposed programmes, and also kind of their interaction with us and how outcomes has really featured on their service delivery. And as Richard said earlier, they are really exemplars in how to do this. Again, we will go in alphabetical order. So Benoit, over to you and Triggerise.
Thank you, Shamsia. As you introduced me earlier, just very briefly, I'm Benoit Renard, co-founder and CEO of Triggerise Tico. Originally from France, as you can hear with my very strong accent, but based in Cape Town, South Africa. We can move to the next slide. Thank you. Just very briefly about who we are. We are a non-profit organization. We actually headquartered in South Africa since the beginning of March, just now. So we are now a fully African organization. The way we work and what we do is that we power a platform which is called Tico, which is based on a massive piece of software that we've developed over the past 8 years. And that powers an ecosystem of partners, allowing users to access services and products. Allowing them means that we provide access, we discount the prices, we sometimes make it free, and we allow our users to also provide feedback. And we've been doing that for the past 8 years, and have impacted a bit more than 2 million people throughout. And to give you a bit of an explanation about how it works, if you don't mind moving to the next slide, Shamsia. Thank you. So we call it an ecosystem approach. When I explain the model, I tend to make comparison with other platforms, you know, Uber, Netflix, an Airbnb. You know, Airbnb being an interesting example. We've got two sides of the market here. We've got actually three sides. We've got obviously our end users, who are the people we are trying to serve. We are trying to make sure that they can have access to products and services that they need. We then facilitate their connection with mobilizers. Those mobilizers are going to be community health workers, peer educators, usually mobilizers belonging to an existing organization on the ground that is a relevant organization. Then that interaction has two objectives. One is to enroll them onto our platform. And I'll tell you just now how we do this enrollment. And the second piece is to generate demand for the services that the platform proposes. So if the platform in your locality proposes family planning services, then the role of the mobilizers is to talk about sexuality, to talk about contraception, about birth spacing, and all of that. So again, a mixture of enrolling you onto a membership that will provide you with benefits along the way, and also generating demand specifically for the services of that membership. Again, the service delivery partners, their role is to provide services, provide products. They are themselves controlled and capacitated by other partners coming in to do some quality assurance, quality improvement. And all of that, again, is monitored through our software. Everybody has access to an app that we power. The end users themselves don't need to have access to technology. If they don't have a phone at all, they get a membership card with a little QR code on it. If they have a feature phone, they will be able to interact with the platform by SMS. And if they have a smartphone, they can use WhatsApp. All of that generates an enormous amount of data. So every single interaction between an actor of our ecosystem and one of the users hits our software in real time, generates some insights because it tells us about levels of activity, about the type of activity, about the quantity, obviously, gives us, again, some insights in terms of which services are preferred, which providers are preferred, and also generates a feedback loop where each of the users can actually rate the experience that they had on a 1 to 5 and provide us with some extra questions. And the beauty of this model is that once you've established your network of partners, you can start to add extra offers based on the needs of the users. And this is how we started to work on mental health. But just before telling you what we are doing on mental health, maybe a point around our data. Next slide, please. So just, these are extracts, very, very loose extracts of some of our dashboards. Because it's real-time data, we get insights about the volume of activity in each of the clinics where we work. On the left-hand side, these are cumulative data, I think, for the past year, broken down by hours of the day. So basically, when do young people access family planning services in Kenya? You can see that it's also very useful when you have a target set, because you can obviously monitor very closely how far you are from your target. You can segregate your target per type of offers or per geography, which makes our field colleagues and our partners extremely aware of what's happening and potentially allowing them to improve the way they work in order to hit those targets, to meet those objectives. And then we've got, because we provide a lot of services on the platform here, I think you get a little bit of a breakdown of it's everything in Kenya in the past 12 months, I imagine, looking at the total numbers. As you can see, we've got things like screenings, distribution of condoms, which are in small quantities actually. And then we start over time to be able to provide some more services around the HIV cascade and so on. Again, having an idea of what the preference of some of the users are or what is busy happening in the community is both very good insight in terms of how to promote certain behaviors. Also an insight about what's busy happening on the ground gives us a good image of breakdowns in the supply chain, or again, potentially a provider bias, which is the kind of thing we are working on. And because we've got this real-time data, we've been a very good candidate to implement outcome-based financing programs. And we've already, so yes, please, next slide. And we have already implemented 2 of them, and we are busy structuring our next impact bond, which will start in July. So we've implemented between 2020 and 2022, the first ever adolescent sexual health impact bond. This impact bond had FCDO, the UK government, as an outcome payer, and CIF, the Children Investment Fund Foundation, as an investor. It was an 18-month impact bond. And the story I usually tell around this bond, and which you can find actually on GoLab, there's an article about it, is that we started extremely with some challenges. It was an implementation of a program in September 2020, which, as you can imagine, in the middle of COVID was a bit of a challenge. And our numbers were not really met at the beginning, in the first few months. And again, the power of real-time data, but also being able to segregate your data extremely carefully, with a lot of granularity, allowed us to identify the geographies and the partners that seem to be working better than others. We started to understand that in some parts of the country and with some type of partners, the demand was generated, the services were accessed. There was an interesting virtuous circle which was busy happening and potentially not happening in other geographies. Those learnings allowed us then to replicate those good practices and scale up all of those practices to make sure that the entire program became a success. And that's how we ended up actually surpassing our target over the course of the bond. In Ethiopia, our contract is slightly different. It's a direct contract with the Dutch embassy. We are, thank you, Andrea. We are implementing an outcome-based financing mechanism where the Dutch embassy has fronted some of the rolling capital so that we can implement our program. And then we've got actually some payment metric leading to one big target, which is the number of services we're going to provide over the course of those 3 years. And then we get reimbursed on the basis of those results. Again, with the mechanism about fronting some running capital. We're a non-profit organization. We don't have, massive venture capitalists behind us. And in the meantime, having this relationship with our donor means that we can also work towards improving again the program along the way in a very transparent manner, with our dashboard being the point of discussion between ourselves and the donor. And then quickly, we are structuring our next phase of our impact bond in Kenya, this time with a new outcome payer, which would be the UN families. So it's a UN SDG fund, together with the Children Investment Fund Foundation again, and with an investor, which is Bridges, based out of London. And now to tell you, we, as I mentioned, it's a platform. So again, the core offer of most of the Triggerise programs are around family planning and sexual health. And we are starting to add some extra services based on the needs of the users and the funding we managed to access. Here in Mombasa, since last year, we've started to actually add some extra HIV-related services, mainly initiation on PrEP and ARTs, which up until now were not part of our offering. We were doing testing, but we didn't have the extra step, which was a little bit of a big limitation. And the other element we've added is a mental health program. We've added it, because of an hypothesis, that is that people may discontinue on PrEP or ARVs because of their mental health status. We also know that a lot of the situation we are meeting in a place like Mombasa has to do with gender-based violence overall, so mental health support is needed. And the last point is because also this program is has an element of target around key populations, so commercial sex workers, men having sex with men, and people injecting drugs, which would require, with the relevant partners, some support on mental health as well, if needed. So we've set up basically an added ecosystem where we've trained some of our existing actors, which was an interesting innovation for us. So helping some of our partners to upskill. We've worked with Strong Minds to be able to build this capacity, both on the demand generation side, but also on the service provision side. And we are then monitoring closely who accesses mental health services and whether there is a link between this output, beginning of an outcome when we can start to monitor the evolution of their mental health through the screening tools, and some other behaviors in the cascade, access to HIV services. So again, testing. Do you want to know your status? Do you want to be initiated on PrEP or ARVs? But also on family planning, which is an extra benefit of the program. And to show you a bit on this last slide, the type of data. So we've got, sorry, two things. A video first to show you just now, to show you more or less how it works, and then I'll show you the data. And to get the sound, I think you should go off mute. You should put your sound.
Mombasa, the HIV prevalence rate at 7.4% is higher than the national average of 6%. We collaborate with local community-based organizations and government groups to reach young people with these free services that our platform TICO offers. Through a 3-year program, we have begun connecting key populations like sex workers of all genders, people who inject drugs, and marginalized members of the LGBTQI community to integrated HIV and mental health care. Since May 2022, over 13,000 young people have accessed more than 20,000 services in Mombasa.
I'm the director of the Region Africa. Region Africa is a sex work organization with membership of 400 young sex workers and 55 older sex workers, that is 18 to 24 and above 24. Our benefit membership of TICO, our members can access reproductive health services, mental health services, care and treatment for those who are positive and negative, and also admin costs. this has helped us to pay our bills, despite the fact that we don't have donor funding or funds for our organization. Our organization has also benefited from this partnership because 3 of our members were trained as therapists. They've reached out to most of our members, and some of them have dealt with their self-stigma, and we've started going back to school, taking up opportunities for employment. Our county government has also recognized our members who are training others from other AYP community because of TICO and Kokoijo membership. Thank you.
Few things about this video. As you can see, this is not a big organization. We are not talking about a large CBO, but a very, very impactful CBO working on a very specific topic around commercial sex workers. And what's interesting in our model is that we have quite a few of those CBOs connected to the networks. Therefore, we can help them be capacitated. Again, as she mentioned, 3 of their members were trained as therapists by our partners, Strong Minds. They can access funding because we pay them per performance, which again works very well in the context of an outcome-based financing mechanism, because we hold them also responsible for hitting some targets. We give them an extra bonus every month based on the quality of the outputs. So that's a 20% part of the revenue that we transfer to those organizations in order to support their own development and ensure they work on their quality and the quality of their training. And to show you, to show you some of the data we have. So basically a few data down there. So in the video, you heard about the total numbers of services that we have provided. I think we were talking about 20,000 services, if I'm not wrong, and 13,000 users, if I remember well. Out of them, 2,400 have been screened for depression. So that means that it's something like 1/5 of the users are basically invited to be screened, and some of them have accepted to be screened and have then gone through the rest of the cascade based on their interaction with the mobilizers or with the providers themselves. Again, some of our providers can detect if it's the moment that we have the discussion, can use some of the screening tools that we've embedded into the app to start to initiate this discussion and potentially move further into support and treatment. Thank you.
Great, Benoit, fascinating. I wonder, Richard, just take some advice because I can't see the chat, whether we move on to Tim or we take a pause and take some questions if there are any directed to Benoit right now.
I don't think we've got any specific questions directed for Benoit. There's quite a number of comments, quite a bit of excitement. Emily from Bookings references some work that they've done, a blog they've produced on different types of data needed in outcomes funding.
Okay. We'll move on to Tim.
So great to hear LGBTQI referenced here and being included in the HBGI objectives as well. I think we can move on, Shamsia.
Thank you. Benoit, thank you so much. Tim, welcome. Over to you.
Cool. Thank you very much, Shamsia. First of all, a quick apology. I've got a very vocal and very boisterous 2-year-old that's due back home any minute. So if you hear some screaming in the background, that would be Max. And yeah, just a quick introduction. So my name is Tim Conybeare, the founder of an organization called Waves for Change, originally from Oxford in the UK. Andrew, I see that's where you are. Actually, I'm there tomorrow. I'm flying back to see my mum and dad. And I've been in Cape Town for the last 12 years. Yeah, leading the Waves for Change organization. We use sports basically as a vehicle to provide evidence-based mental health interventions to young South Africans. We work mainly in the prevention space. So we start working with children from the age of 11 onwards, children who are starting to show the first signs and symptoms of mental health challenges. Our work basically grew out of a PhD. So we wanted to understand, what does it mean to be a child growing up in South Africa? What are the experiences you're exposed to? What impact does that have on your physical and mental health? And then we wanted to work with kids to design programs they want to be part of. So I think that gave us quite a deep understanding of what it is to be a child here, and then design programs that were evidence-based. So we looked at all the kind of global literature on mental health promotion and prevention. We took the recommendations from a cohort of 250 children that we interviewed. We developed a model that could essentially draw them into these evidence-based programs that we know work. It's been really interesting working with the Healthy Brains team. I think we've always been fascinated by outcomes. You know, as an organization, we have quite a strong research arm. We want to know why our programs work, how they work, and I think it positions us really well for outcomes-based funding. So refining some of that thinking over the last few months with Richard and Shamsia has been really valuable. So thank you guys actually for your time. The slide in front of you just pulls out some of the key data from the published piece of research we did. That was back in 2015, if you want to have a look online. It doesn't say, just looking at the people on the call, I think you understand everything that's on this slide. I suppose the nuance for us, and when we think about outcomes funding, is that the mental health challenges we see in South Africa are quite nuanced. The way we, I suppose, describe them as more of a toxic stress response to what's going on, to the environment that children are growing up in. So we find that children here experience a huge amount of adversity in childhood, between 6 to 8 heavily traumatic experiences every year. The benchmark in a country like the US is 5 of these experiences in a lifetime. So children are getting consistent exposure to stress. Their bodies, obviously, you have a stress response, releases different hormones, and the buildup of those kind of stress hormones becomes toxic, and it changes the way that children's bodies function, the way their brains function, and their capacity to kind of self-regulate, form meaningful social connections, and to take on new information. So when we think about measuring mental health outcomes in South Africa, some of the kind of more established tools we find aren't that sensitive to kind of the toxic stress context that we're working in. So I'll talk a little bit more about that at the end. So understanding that this is the problem, you know, children here have huge amounts of adversity and they're struggling to cope with it. So what's the response at a government level? So Shams, if you just go on to the next slide. This is Khayelitsha Township. So this is just down the road from our office where we work. Community in Cape Town, informal community outside of Cape Town of about 1 million people. And this is the infrastructure in place at present. Department of Health, about 5% of their total funding goes to mental health at the moment, and 78% of that money gets spent on treatment services, these kind of apex services at the top of this pyramid. So psychiatric hospitals, Khayelitsha has 1. You then have nurses at community clinics. Khayelitsha has 8 clinics, but only 5 of them are operational. So at a treatment level, it's hopelessly understaffed for the population. At a community level, when you're trying to intervene early, identify, screen, refer for treatment if possible. The main actors there are school psychologists. So you have 1 psychologist allocated to every 10 schools. Populations at schools are between 500 to 1,000 young people. So you get some pretty terrifying ratios of counsellors to young people. The outcome there is obviously that the bulk of children in these communities who obviously have a great mental health need can't access it. The research, the Child Gauge, which is an annual report published here in South Africa, identified 90% of children who need mental health support never receive it. That increases the pressure on these apex services. So what we actually need, the solution that we feel that ways to change is you need to introduce new services at this community prevention level that can make a difference. And this is where we wanted to put children's voice at the very heart of those program designs and say, if we're going to build programs, like, how do they need to look? So that's the next slide. If you go on to the next slide. This is what kids said they wanted. We worked with 250 children from Khayelitsha Township, and we said, map your life using photos, and we pulled all the different information out from those photos about what are their daily experiences of being a child in this community. Very difficult. How would you design a program that can help you cope with what's going on? And these are the 5 key recommendations they made. They wanted mainly to have fun, so they wanted to do something that's fun, difficult, challenging. So within Ways for Change, that's why we chose surfing as the task. In South Africa as well, it has a particular importance based on the segregation of the beaches and things like that. So surfing, that challenging task, they wanted, kids wanted to get somewhere that was safe. Obviously, they come from very adverse backgrounds, and they want to talk to people that genuinely care about them, so who are emotionally invested, as well as creating this physical space around them. So you've got these kind of 3: a caring adult, a safe space, something fun to do. Children also wanted to learn some social emotional skills. They're not, they're experiencing a lot of very difficult emotions that they struggle to deal with. They want to be taught how to deal with those. And once they're in these spaces, they want to be able to connect with other opportunities as well. They don't just want to be stuck in this one single kind of channel. They want to be able to see what else is going on. So based on these kind of 5 recommendations, we were able to build a number of different kind of programs, all hinging on sport, the main one being surfing. The next slide shows a bit how we operationalize. Obviously, if you want to create a sports program that has a mental health outcome attached to it, you need a coach. That's the scalable unit. So how many of these people could we train, and what skills do they need? So on the one side, we knew that we needed young people to be upskilled in practices to create meaningful connections with young people. How do you have a conversation? How do you listen? How do you follow up on a difficult conversation? So lots of skills about how do you use sport to create these social attachments with young people? How do you play together in a way that encourages kind of meaningful connection? And then at the other side, we wanted coaches to understand, how do we integrate some really simple activities that teach children self-regulation skills? So a lot of the activities that we use can be integrated onto a beach, but equally onto a basketball court, a football court, really simple breathing techniques, strength recognition techniques that are used kind of before or after a sports practice. The next slide talks a little bit about what this looks like on the beach. So our main work at Waves for Change is we train 45 coaches in those skills that I just showed you. Those coaches manage 5 beach centers that we've built in South Africa on 5 of the kind of more under-resourced high-risk beaches across the country. Those beaches take 2,500 referrals every year from clinics, hospitals, mostly school psychologists. That's our main in. And once a child's referred, they go through a 10-month course, and they attend as they would a counselling program, 1 session per week for 10 months. After 10 months, they're screened for kind of changes to their mental health. If they've got a significant increase, they go into an aftercare pathway that helps maintain that gain. So they come to the beach once a month. If they haven't shown that outcome, they go back into the program, and we keep them going a little bit longer. The next slide shows some of the outcomes. So like I said, we struggled for a long time to meaningfully measure the mental health gains. We used lots of typical screening tools, and we found at baseline children were quite dysregulated. They weren't very connected to their emotions, and it was very difficult for them to complete these self-reported surveys. So we started looking at physiological biomarkers to track changes in how children's bodies and brains were developing. We worked with the New School for Social Science Research, and we trialed a heart rate variability measure, basically tracking the amount of stress that your body's carrying. So on the left-hand side is the result of that study that's just being published at the moment. We adjusted for age because your HRV improves with age as well. And you can see on the left-hand side that we had some nice kind of statistically significant improvements in HRV across male and female participants, essentially meaning that children are settling across the 10-month duration of the program. On the right-hand side, we used a survey looking at reported feelings of positive and negative arousal. We were particularly interested in the negative arousal, children coming from very traumatic background. So we wanted to look at, are our programs decreasing the regularity and intensity of these negative emotions, fear, anxiety, and we found they are. So this, as I say, this paper is now being published. It's for us very useful because we know what the outcomes of our programs now are, and it means we can attach payments to these outcomes potentially. I'll talk a little bit more about that just now. What we then started thinking is, well, if we can train coaches to use surfing to promote health at our beach centers, there must be a way that we could scale our offering. We know that coaches are the key mechanism for scale. So how can we train more coaches to use sport to create these safe spaces where children can learn, form new social attachments, but learn self-regulation skills? So we formed a partnership with Elm and Peace in Somalia in partnership with UNICEF. Jamie, the researcher, is on the call today, so I hope he's not going to, hopefully, Jamie, I do this justice, your data. And some of these are basketball coaches who work for Elm and Peace that we trained in what we call our 5-pillar method. How can you use sport to create these 5 recommendations that children make? If you go to the next slide, it shows how we train them. We do a 1-week grounding training with all these coaches, just teaches them all about, why do we believe sport is an effective tool for mental health promotion? Gives them all the skills they need to form these attachments to young people, all these activities to teach self-regulation skills. It's not just a single training and then we disappear. We then have bi-weekly support calls with these coaches. So it's ongoing professional development. And then we use technology as well. So we have a little WhatsApp channel where we can send videos of sessions, voice notes explaining key teaching theories, something we've started to build out. So essentially, how can we get more coaches more literate in these really simple practices? The top right just shows that the coaches responded really, really well to the training. They loved it. And you can see the two cities where we're operational just start out there. There's Mogadishu and there's Dusmareb. So really difficult places to be working. The next slide shows the outcomes at a child level. On the left-hand side, you've got a really cool little word cloud. We use this for quality assurance in the program. Are the coaches creating spaces that are conducive to social connections? And you can see these are the words that children associate with the spaces. Obviously, if you get negative words coming back from our surveys, you can course correct fairly quickly. On the right-hand side, we've been testing a few different measures to measure wellbeing change at scale. Really difficult to do, but the WHO5, the World Health Organization 5 inventory is quite a good tool that we found. On the right-hand side, you've got 176 pre and post tests collected across young children in Somalia, and you can see a really positive shift in well-being as a result. So that's again statistically significant data that we're also going to publish shortly. So the next slide just shows how we can scale the offering, the program, knowing that coaches are the key to scale. On the left-hand side, you've got our surf therapy programs that we're integrating more and more into the health system in South Africa. There's only so far we can grow those, obviously, unless we open lots of new sites. On the right-hand side, you can see what we call a system change partnership. So we know that, around the world, sport is a huge language, for young people. So many people get involved in it. So many people coach it. And we are now able to form partnerships with, similar to what Ben was saying, community-based sports organizations, inherent understanding of their communities, locally connected, local coaches, and we can train them in this really simple coaching methodology, this 5-pillar method. How do you use sport to help kids form these connections and self-regulate? So that's what we're starting to push at the moment. So we have pilot programs in Mogadishu, in Somalia, in Khayelitsha, just down the road from here. And we've done some quite interesting work in Freetown and Sierra Leone as well. We published some papers on that. The last two slides just talk about payments, really. How do we manage an outcome payment project process? Obviously, as a non-profit organization, we don't have huge amounts of funding and positive cash flows. So we need to find a way of paying for outcomes, but also paying for critical inputs and attaching payments to little kind of mechanisms as the programs evolve, as you see children's health improving, because that's going to help with our cash flow. So what this slide shows you here, what are the actual mechanisms at play in these sport for health programs? What are the things that need to be happening in order for mental health improvement to be predicted? So obviously you have the coaches that get trained, and those coaches then need to create these three kind of key, kind of settings in their program. So first, a social domain needs to establish. Kids need to feel connected to each other. And you can ask that really quickly in a survey. So after a child is referred to a program, you can ask them, do you feel safe? You can ask a quick survey, and I'll show you the technology we use to do that. So that, again, if you get a positive response there, you can potentially attach a payment to that. You need to see if children are attending regularly and enjoying the sport, because if they're enjoying the sport, they're going to start experiencing this respite from the stress. They're going to get more immersed in the sporting component. And then in between these, you've got the capacity of the coach to teach self-regulation skills. So we can see if children are learning these skills. You can survey them at 3-6 months. And as that data comes back from the field and you say, okay, the coaches are creating these conducive environments for mental health gains to improve, you can attach payments to those survey results. So that helps with the cash flow of an outcomes payment program potentially. And then finally, I suppose look at the technologies as to how we track this. Live data is obviously king. It's what's going to help us make sure that the Richards of the world get the data they need, and we can actually deliver a really effective program. So these are the payments to launch a program. Let's train a coach, let's get kids in, and as a coach is trained and kids are referred, we can attach payments to that. So that gives us cash flow to start delivering. As the programs are delivered to these young people, we can see our children attending. So kids attending 50% of their sessions, they're attending regularly. That's going to predict a good mental health outcome. You can attach a payment there. As children report feeling safe, making new friends, again, you can attach payments there. So that supports the ongoing delivery of the program. And then when you get to the outcomes measurements and you've supported the main operations, you can then attach payments to children who report improved mental health. So we've used the WHO5 survey quite effectively there. And also we're piloting how we could use a heart rate variability measure at scale. That's quite difficult to collect, so that's still an ongoing project. The technology behind it, sorry, I thought that was the slide to come, but this is the tech behind it. So we've built a system. We got some money from a Silicon Valley Foundation a few years ago, and knowing that we need to track child adherence to our programs, coaches being trained, coaches delivering sessions in the field, what children are being taught. You can see in the middle the subjects that they're learning and being taught. We built this system called TeamPact. Again, all the outputs are tracked through here. It's live data. It's all audited through kind of third-party evaluation, so you can drill down very quickly. And yeah, this is kind of how we see us being able to introduce new services at a community-based level, because I think that's the big challenge when you're operating in countries like South Africa, where there's not even a network to refer children to. We need to build that. We need to build that kind of service delivery, especially at the bottom of the pyramid first. So that's kind of what we've done at Waves for Change. We've put children's voices at the very heart of those programs, so we know that they're programs that they want to come to. We now know the outcomes of those programs, that sport really can promote health. It can do it really effectively. The coaches, you know, they're young people. They don't need to be literate in really complicated therapeutic practices. The sport will do a lot of the heavy lifting, allowing the coaches, you can scale those coaches quite quickly. And we now know the outcomes, talking to Richard and Shomzia around using those outcomes and structuring them in a way to support cash flow has been really valuable. So thank you both for your time. But yeah, thank you for the opportunity to present. Jamie, I hope I did your data justice, and I'll pause for questions. And again, thanks for the opportunity.
Great, Tim, thank you. Thank you. That was fascinating, both from you and from Benoit. Richard, can I turn to you and Roxanne to help navigate through the questions? Perhaps we'll go to the floor again, so to speak, first, and then look at chats. Are there any hands up?
We have no questions at the moment in the chat room. Lots of comments thanking both Tim and Benoit for their presentations.
Great. Any further comments? Right. Benoit, Tim, clearly really comprehensive. Hearing it the second time. Go on, Benoit. I was going to say
No, just Richard and the rest of the committee. I like the comments of Kimberly, and it's a question I have actually about such tools, outcomes funds, whether this is a kind of tool that can attract individuals, private donors, as we said, in the case of Tim, it could be potentially surfers, etc. Have you thought along those lines, Richard?
Yes, indeed, I have. Look, Kimberly's on my board, so she's not going to let me. She's not letting me get away with anything. And she's flagged this with me already. Look, we're about to do. We're recruiting a couple of new members of staff. One of the things we're going to do is a bit of a comms refresh, including our website, and we need to think about how we create mechanisms to try and engage with people like that, and actually provide a mechanism for them to donate if they'd like to. Again, this is one of the reasons, why we've gone for these thematic outcomes funds, because many of these donors have particular themes that they're interested in. In the sports world, there is such a lot of interest in the utilization of physical activity in sport to make a difference, whether it's surfing or whatever. There's a whole wide range of them. We haven't geared ourselves up for it yet. Look, my background is in bidding for government contracts, not raising donor funds. So I'm learning as I go, but we're listening to Kimberly and we're going to do something. Thank you.
And we're happy to learn from anyone here who may have some tips on that.
Jamie Marshall has their hand up.
Yeah, hi everyone. Tim, don't worry, he did fine on the data, but just a comment really around one other thing on that program is part of that training involves upskilling around research and evaluation. One thing we have to be very aware of in sport for development, for example, is the research is dominated by a couple of institutions in the United States and United Kingdom, which isn't appropriate necessarily. And there is a lack of funding available to support those evaluation processes. A lot of the time funders want outcome-based funding, but there's not funding to support the things we need to be doing to upskill evaluation at the sites we're working with, or even to support the evaluation processes within whatever we're trying to develop. So it's just a comment really that so often we see this demand from funders around, sometimes quite complex outcome measurement, but there's a lack of support in terms of the costs it will take to realize that, on top of the obviously necessary costs of delivering interventions or training coaches or whatever it may be. So I guess it's just a comment that anytime we're making those demands, I guess we also need to recognize the costs that may come with those and how we manage that.
It's a really good point, Jamie. When we contract through HBGI these programs, we're going to have to ensure that there is a data capture system in place to capture this stuff and make it available. And then we're going to do a whole bunch of research, and the research that I have to say always really gets me is the embedded research in delivery, which is a monthly review of what's going on and how do we constantly improve our impact. But I recognize that wider than that, we need to make this learning more generally available in order to inform elsewhere. We have an intention to attempt to raise funds to try and sit some hard-nosed academic research alongside our programs. And I think that will be a different sort of funder, and we'll have to fundraise it for it differently. And then we also need to try and stay as close as possible to Andrea and her colleagues at the Go Lab. Andrea is on the call here, who are right now trying to build a global coalition of data. Well, do you want to describe it, Andrea, this initiative across yourself and the other institutions?
Hi, thanks, Richard. Hi, everyone. And thanks for the shout out, Richard, to our work. Really, it's just been an organic, I suppose, attempt for the Go Lab to try to connect the dot across all the different initiatives happening globally around outcomes-based contracting, outcomes-based partnerships. We're an academic census. We do an awful lot of research focusing in particular on impact bonds and outcomes-based contracts in the UK. But internationally, we've tried through our convenings and so on to offer a platform to help facilitate better learning. There's so much interesting practice happening all over the world. And I've been messaging various people on this call, kind of saying, oh, are you speaking to this person? Are you aware of this initiative? So as much as we can, we're trying to create those links. But there isn't a global mandate, if you like, or funding for this work to happen in a really coherent way. The key thing, I guess, that we're trying to do is to bring together all the practitioners, policymakers, potential donors, researchers, at least once a year at our annual conference. But it would be great to be able to do much more. And I guess as a global community, have a more consistent and coherent learning agenda so that we're not kind of like reinventing the wheel every time we're launching a new outcome fund and so on. So yeah, hope that gives a.
Well, I was also thinking, Andrea, specifically about the initiative that Mara is pushing to create a common database, if you like, with yourselves, University of Cape Town and another institution.
Yeah, absolutely. The Inspermetrices in Brazil. So we recognize, and I think it came up a couple of times, and Emily, you've shared a very helpful article around the importance of data. So one of the key barriers around accelerating some of the practice and accelerating the learning has been the availability of standardized open access data on this contract. So we've started building a global data set on impact bonds. We started with projects in the UK. It's now global. It includes over 270, I think, impact bonds. So anyone, anywhere in the world can go and access that information. So at a glance, you can see where in the world there are projects, what kind of outcome metrics they are using, and what kind of organizations are involved. But we're a small center based in Oxford, and we actually want to empower regional players and regional organizations to own this data and push it back into the community so that it's used very actively. So with support from the Children's Investment Fund Foundation, we were able to establish a number of partnerships with local academic institutions or research institutions, one in Brazil and one in South Africa for now. We're hoping to grow it. Hopefully we'll have a data steward in India and other parts of the world too. But again, it's quite challenging to manage this coordination and find organizations that are willing to play this sort of like ecosystem building role in a kind of, long-term sustainable way. But we think data is really important, and having it open access. So kind of if anyone here is keen to partner on that, and obviously Richard, as the outcome funds that you're developing kind of move into I guess design and implementation, it would be great to link up, if nothing else, on the data standardization and making sure that with the kind of data that you guys are gathering can be plugged into the data set so that others can use it and learn from it.
Brilliant. Thank you, Andrea. I have no more questions in the chat room, Shamsia, unless I'm missing any.
Right.
And none in the room. Would you like to take us on to next steps?
Brilliant. So, thanks again to Tim and Benoit. A really thorough presentation and a really well received presentation. I think if we'd moved out from this virtual world into a real world, you would have heard the resounding sound of applause. So in the absence of that, thank you very much. I will move us on. If you give me a second, I'll bring the slide decks back up. We are nearly towards the end. We're nearly there. So thank you for being with us. I just want to give you a broad, quick outline in terms of the way forward for us. So what are we doing with this report? What's the follow-up since we published the report? This slide gives you a sense of our target audience. We started off focusing on donors and potential funders, but actually our audience is much broader, and it includes the likes of GoLab that Andrew is part of, and it also gives you a sense of our distribution channel. On that, please do share the report as widely as you want with your own network. We encourage you and we very much welcome you sharing that report. We're really passionate about having an impact and showing that impact on the individual service user. So we really want to use this report to raise awareness of the growing mental health challenge that you are all aware of, but also to show and promote the benefits of using outcomes-based contracting to address that challenge. So again, please do share the report widely. We, in support of the report launch, but also recognising our role, we are also going to be hosting a series of free virtual workshops over the next 6 to 7 months, open to all, and it's really to help support the service provider market in terms of building their capacity and understanding around outcomes. So I absolutely encourage you to register and join, and hopefully see as many of you as on those workshops in the near future as possible. This slide gives you a sense of the timeline. We're aiming to have one every kind of 6 weeks, and also gives you a sense of the themes for the workshop. The first one will be an introduction to outcomes-based contracting. What Richard covered today was a really brief outline overview. We will go into much more detail. And then kind of June, July, we move into the operational phase. So what does that mean for you as a service provider as well? So building effective performance management framework and contracting, but also thinking of it from an operational perspective. What does that mean for the design of your service if you are being paid on outcomes? And then in September, we hope to have a session on working capital as requested by the service providers we've already engaged with. And we will cover things like loans and social impact bonds in that one. And then a final session on writing tenders. We will promote these workshops ahead of time. We will email you all. We will use our social media. We'll put it on our website. So please do look out for them and do join. They are free. And we hope to see as many of you there as possible. I think, Richard, I forgot that we were going to pause for any final questions and comments. It does not have to be about.
I think we've done that now, Shamsia. Let's. Right.
Well, Richard, then it's over to you for concluding words, wrapping up and.
Okay. Thank you, Shamsia. You know, I'm a big fan of outcomes, performance-based contracting. I've worked on this for 23 years. I've seen what doesn't work. I've seen systems failing, and I've seen the potential impact of contracting in this way. But I can sit and talk about this until I'm blue in the face from my study at home. And it only really comes to life when you start to hear about the people who are really doing something out there on the front line, really touching lives, really creating solutions, really putting the service users, the individuals, the young people, whether that's out there in Kenya or South Africa or beyond, at the center and the heart of these services. It's then when you understand both the need and the potential response to it. And when you read, I hope in this report, about 51 programs that came forward when we put out this call for expression of interest, that put their faith in us with no funding out there to actually come forward and say, look, this is what we're doing and we'd like to flag it with you. Huge thanks to Shamsia for all the work that she's put into this. It's been a major task over the last 6 months. A lot of that collaboration that you've felt, Pavel, I think is down to Shamsia and the whole way that she has approached this and shaped this report. I'd also like to give a shout out to our designer, who is called Daria, who sits in the Ukraine and does all of our design work for her, who I have nothing but admiration for. And finally, thanks again to Benoit and to Tim for describing what I think are two incredibly inspiring, impactful, innovative programs. I love them because, I mean, they appeal to me because they're so concrete, you know, they're structured to deliver impact on the people accessing those services. They're not just saying, hey, we've got a good idea, let's get people to come and do some surfing, and that'll bring them in, and then we'll do some personal development stuff. They've built evidence-based delivery models that actually link the inputs in a concrete way to the outcomes that they want to achieve, to the impact that they're looking to achieve. They've got that evidence chain, that results chain in place, and then they track it. Then they use data in a really clever way. They capture the data in a really clever way, using tech in a way that is appropriate for their locations and their populations. And they use that data to drive what's happening on a day-to-day basis, to drive their longer-term strategy at the same time. And they maintain and use all of this to keep pushing the performance of those programs. I think outcomes-based contracting has got the potential and the power, when done well, to help facilitate that process. I hope HBGI, we identify this huge gap in the market. You've got a whole bunch of organizations who want to deliver outcomes, who know how to deliver outcomes. We've got a whole bunch of people who need outcomes, but we don't have outcome funders. Our global institutions, our wealthy nations spend their money in other ways. And I think we need to demonstrate, well, we initially want to fill that gap and create the outcome funds to pay for those outcomes. And in the process, through that, demonstrate the real power and potential of this. Look, thank you for dialing in today. Thank you for spending time and reading this report. Thank you for delivering what you do. It's been great, and goodbye.